everybody, I hope you're having a good day. So I've got a ton of inquiries about Medicaid dentures. So there's a difference between Medicaid and Medicare. Medicaid covers anyone from 18 to 65 with income requirements. You're eligible for dental care through Washington State Apple Health. Now, it is income required. There is low income required, but believe it or not, their income eligibility is pretty lenient. So a lot of people qualify and they don't think they would. So it's worth it to give it a shot. Now, there is 4 different ways that you can apply. One is online. 2 is over the phone, which is my biggest recommendation, is do it over the phone. The 3rd is through mail. And the 4th is going into a resource center, something like DSHS or a hospital, something like that. Your community centers, they have the availability to help people apply for benefits as well. So what you do is you want to get in and you want to apply. Over the phone, it took me about 45 minutes. 30 of those was on hold, so not too bad. They'll ask you your social security numbers for everybody in the household, birth dates, and income income information. So whatever your income is, you'll have to just give them that information. They don't ask for documentation really, they just ask for the amounts. So pretty much know all the information for your household members. Now, once you get approved, you're going to ask them for your Washington State ID number. And once you have that number, you can start making appointments without the cards. The cards usually come in 2 to 4 weeks, but I've never gotten one, so I don't know where they went. They didn't come to me. So as soon as you have that, I would wait a couple days. Your insurance will retroactively go back to the first of the month that you applied. So if you applied middle of June, it would be retroactive back to the 1st of June, which is great. Now, every state picks its own level of benefits. So if you live in a more economically challenged state, say in the South, something like that, they usually don't cover adult dental very well. The West Coast states tend to cover it really well. So they cover adult dentures and partials. They cover braces for kids and things like that. It's actually pretty great. They'll cover all your extractions. They do not cover anesthesia. They do not cover implants and things like that. So just keep that in mind. And they only cover permanent dentures. So you will not get temporary dentures out of them. You will have to wait 3 to 4 months until you're healed up or your dentist gives the okay. But once you have the approval from them, you can start calling and making an appointment. My suggestion is be willing to travel a little bit because the bigger range that you have, the more availability you will find and more providers. Take any appointment you can get. You can still call other places and look for something sooner, but just at least secure one appointment so you at least have one. If you live on the east side of the mountains, I know availability isn't as much as on the west side. I went to Peak Dental in Linwood and they were amazing. They have lots of different offices from Tacoma all the way up to, I think, Bellingham. So they have a lot of different offices. So make your appointment, get in for your consultation. Once that consultation happens, you need to tell them you want to request dentures and full mouth extraction. So here's the deal about extractions. They can only pull up to 4 teeth at a time without having an approval from the healthcare authority. So unless you want 4 teeth at a time pulled within, once a week, I would just wait for that approval unless you have an emergent situation. You need to make sure that they submit the paperwork correctly. And that's where I went wrong. I didn't follow up with them for a little bit and found out that they didn't submit it correctly. So it got rejected and I had to start all over again. So once the consultation is over, ask them to submit the paperwork and then wait a couple days and then call them back and make sure that they did it right. If you have to talk to an office manager, that's okay. Just make sure that they sent the paperwork in right. Now, the healthcare authority says that it takes 14 to 16 weeks. That can vary. I've seen it come back a lot sooner than that. So that's really worst case scenario. And it's okay to call the healthcare authority after a few weeks to make sure that they're processing your application. So just kind of be your own advocate, check those things, make sure that they're on top of it, that nobody dropped the ball, because if somebody drops the ball, you have to start all over again. And it's a lengthy process. So they will send you an approval letter through the mail and they will also send it to your dentist. Now, this is the one hiccup. Whoever submitted the paperwork is the provider you're authorized to go to. So you get the approval letter, decide you don't like your dentist, can't go to another one. You have to switch the provider with them, which is another month to get that done. So make sure that you're happy with the provider that submits the request because you can't switch that without a little bit of a time frame. So here's the thing about Washington. Washington has denturism, which is awesome. We allow denturists to practice here, and I love that. So what I did is I didn't want the dentist making my dentures. I wanted to go to a prosthodontist or a denturist. So I got my extractions done. Now, the healthcare authority makes you wait 3 to 4 months anyway before they'll actually let them start making your dentures. You have to wait anyway or have an alternative method or backup for immediates or temporaries. So as soon as I had my extractions, I picked the provider I wanted to make my dentures. I went in for my consultation, had them do a request to change providers, and it's pretty easy for them to do, and by the time you're ready for your permanents, they have the approval to start making your dentures or your appliance. So it's pretty easy to do that, but the provider is the one that has to do it. You can't submit that paperwork. You have to go to the provider for them to do it. Same thing for getting your extractions and everything started. Your provider has to submit the paperwork. So it's not that hard. It's just knowing what steps to take. So you need to apply. Once you get approved, you need to make sure you make an appointment, go to the consultation, make sure they submit the paperwork, follow up on the paperwork submission, make your appointment for extractions. They'll cover nitrous oxide, but they will not cover anesthesia and they will not cover avioplasty. So unless it's absolutely medically necessary, which is really hard to get anyway, even with a doctor's note, don't even ask for it. It'll just hold you up. Once you get your extractions and everything done, if you want to switch providers, it's okay. Make the appointment even in advance before your extractions for right after you've had them. Go in for your consultation and ask them to switch providers. Takes about 30 days, but it's doable. So I went through mail order for my temporary dentures because I didn't want to be without. I used Klein. They were amazing. I loved them. I'm a little over 2 years out with my dentures. I got my Medicaid dentures, these ones, at 4 months. And they still fit amazing, no adhesive, no nothing. I love them. They're high quality, they're fantastic, and I wouldn't have chose any other. So I can say that I got a really good set through Medicaid, and I'm really happy with the service that I was provided. So just, it doesn't hurt to try to get qualified. And once you get qualified for the Apple Health Dental, it's a pretty smooth sailing thing. You just have to find the provider. Once you find a provider, get in, get the process started. And once you get the process started, it goes pretty smoothly. You just have to make sure that you check up and make sure things are rolling and be your own advocate, because if you don't, things kind of get lost in the cracks. So if you have any questions, I'll be happy to answer them the best that I can. I will put links in the description of this video so you guys can have some direct access of where to go. I'll be happy to answer any questions I can, but remember, each state is different on the way they handle Medicaid and how they set their benefits. So it's really up to your own individual state. I will also put a link to Klein if you guys are interested in that. But if you're interested in Medicaid dentures, definitely start the process. It takes just a few minutes to get qualified over the phone, and believe it or not, a lot of people are eligible and don't take advantage of the option. So please use it. It's there for people when they need it. And I think it's a really great option for people. And we're lucky to live in a state that provides it. So definitely give it a shot. It doesn't hurt to try. I hope this helped you guys out, and I will see you in the next one.